Hello everyone, welcome back to my channel. And the topic of discussion today is epilepsy. Now, these are the cases that, as homeopathic physicians, we may encounter in our clinical practice. So, basic understanding is required when we are taking the case, analyzing the case. So, let's walk through epilepsy. There are certain terms which are interchangeably used, which are epilepsy, seizures, and convulsions. Now, obviously, these terms have different meanings, even though they are interchangeably used, especially by the patients themselves. Now, normally in our brain, the discharge of the electrical activity from one neuron to another neuron is of asynchronous nature. It is always normally asynchronous discharge. So what happens in seizures is when a group of neurons, they start to discharge synchronously. That is where the problem starts. So it is the disturbance in the electrical activity of brain which is manifested in motor, sensory, and social way. So this is how it will come. Now, when do we say it as epilepsy then? Epilepsy is actually when the seizures, they occur repeatedly. These are repeated few times. And convulsions, this term is used when seizures only have motor effect. There is no sensory or social effect. Now let us talk of the causes of epilepsy. In order to just remember, try to remember the term vitamin. So V stands for vascular. If there is any vascular malformation, any disorder in the vascular system, it can cause epilepsy. Often idiopathic causes are also there. Traumatic cause is very important and also very common. Autoimmune, any autoimmune disorder can bring epilepsy. Metabolic disorders can also give rise to epilepsy. Infections, whether they are viral or bacterial, can give rise to this. And of course, neoplasm in the brain can also produce seizures or convulsions. Now let's talk of the triggers. What can trigger an episode like this? Very high fever or maltreated fever. Of course, head injury, loud music, strong bright lights, sleep deprivation, emotional trauma, which is strong and unbearable for the patient, and then drug withdrawal. Often patients who are already on anti-epileptic drugs, and when they are withdrawn from that, they may end up having triggers. Now, when we talk of the types of seizure, there are certain types that we must be aware of. First are the focal seizures, which are also called partial seizures. Now, they are never idiopathic. What do we mean by that? It means there is always some structural cause behind it. So if we are suspecting a focal seizure, CT MRI becomes an important investigation. Now here, in simple partial seizure, the patient usually remains conscious. Sometimes in complex partial seizure, or which is also called as temporal lobe epilepsy, patients may become unconscious as well. And these patients present with a very well-defined aura. So they will tell you that what begins before the epilepsy starts. The second type is secondary generalization Now these will start at one focus and then they will move further. So that is why these kind of seizure are also called as Jacksonian march. So what happens is, in brain many areas are affected. It's not one point at which the discharge is synchronous. After the attack, many times the patient will tell you that there is this weakness that comes, which is also in medical terms called as Todd's palsy. The third type is tonic-clonic seizures, or also called as generalized tonic-clonic seizures. Usually these are the ones which are idiopathic. The cause is often unknown. They will start suddenly and there is usually no aura, or it is ill-defined. So this is where the patient will not be aware of any aura. And this can occur in any position. Patient may be sitting or lying or sleeping. And there is sudden loss of consciousness. So patient may end up falling and can sustain injury to head or any part of the body. Now, then what happens is, once the patient falls, all the muscles, they go into contraction. So there is a contraction phase. Often a patient may present with tongue bite, bleeding tongue. So you have to check for that. And sometimes the tongue may fall back and can cause respiratory arrest. So it's very important to check for these signs. So this is called as tonic phase. And then what happens is, after a while, the muscles start to relax. So this is called as clonic phase. So that is why generalized tonic-clonic seizure. Now this can continue for a few minutes. It can continue for maybe half an hour or so. This can keep going, alternating. So patient may pass urine, they may pass stool. You can see frothing of the mouth. And gradually the patient will regain the consciousness. But what happens after that is amnesia. The patient is unaware of such episode, but can have headache for maybe a day or two. So they can tell you that I'm having headache, I don't remember what happened to me, but everyone around him will tell what happened. So this is generalized tonic-clonic seizure. Another kind of seizure is absence seizure. Very classically seen in pediatric children. So pediatric OPD, you will see these cases. Children having transient loss of consciousness. So parent may tell you that suddenly he is just lost. and there is no postural falling or anything like that. It is just stoppage of activity what they are doing. So all of a sudden, whatever they are doing, they are playing, they are studying, coloring, anything, it's gonna take a pause for a few seconds, and then they will come back into consciousness. So basically it looks like a daydreaming sort of a thing. We don't know what's happening, he's just lost. They may have blinking, or they may start to chew rapidly, and it can happen hundreds of times throughout the day. So the parent will tell you that throughout the day there are episodes where he is daydreaming, and the teachers may say that he's not performing well in the class. All of a sudden he's just lost. So we have to definitely go for EEG in this case. There is a classical spike that is observed, and the patient is diagnosed as absence seizure case. Another kind of seizure is myoclonic seizure. Now here there are shock-like movements that we will notice of maybe one limb, maybe hand or leg, or maybe half of the body. So one half of the body will suddenly have a shock-like movement. And often, the patient will tell you that soon after waking up in the morning, this can happen. Or even just doing normally, the patient may have this. And they just don't worry about it. Okay. It is also common in children. The sixth type is salam seizure. So with the word, you may guess that what is the position that appears. It is actually a kind of infantile spasm. So seen in infants. In pediatric OPD, you can see this. So soon after birth, if there is any trauma or a case of hypoxia, the child may undergo such change and can present with the moment where the arm goes near the face and they represent like they are doing salam. In the EEG, they can have hyperarrhythmias. Sometimes in many syndromes, children born with some genetic syndromes can have this associated seizure. There are many syndromes which have seizures associated with them. Now, I want to highlight on the difference between syncope and generalized tonic-clonic seizure. It's very important to have them as two differential diagnoses. Now in syncope, the position is usually standing. So while the patient was standing for a while, they may suddenly fall, and it could be because of syncope. But in generalized tonic-clonic seizure, it can be in any position, as I told you. In syncope, there is loss of postural control. So the patient may suddenly lose control. Here also, it is loss of postural control. Now, patient can become unconscious within few seconds. Here it is immediately. The duration of being unconscious again can be of few seconds. Here it can last for hours. And returning to consciousness again he can be back into consciousness within seconds. This can, as I told you, can take hours. Tongue bite is usually not seen in syncope, but it is seen in generalized tonic-clonic seizure. And loss, micturition or stool these are not passed while the patient is unconscious in syncope, but in generalized tonic-clonic seizure, this can happen. Tongue bite is actually a classical symptom of generalized tonic-clonic seizure. So the patient may come with bleeding tongue. Now, tongue is a pure muscle. There are no bones, and it is surrounded by 32 teeth. It's always moving, but we rarely have tongue bite, Now, if someone is having seizure for the first time, first episode, can we call it epilepsy? Should we put it under the diagnosis of epilepsy? No. The reason is because, again, we must understand that there are other conditions that can present likewise. So this is actually a pseudo seizure. We must check for other diagnosis, other differentials. It could be hypoxia, it could be hypotension, it could be hypoglycemia, it could be hypocalcemia, it could be hyponatremia. In case of subdural hematoma, this can happen, or sometimes in any case of toxicity, this can happen. So we have to screen all of these and then diagnose something like seizure. Now, what are the investigations that we must think of? Of course, to rule out all these conditions, CBC, urine routine microscopy, random blood sugar, electrolytes, very important, especially sodium. Then, in order to rule out uremia, we can go for KFT. In order to rule out hepatic encephalopathy, go for LFT. And just to see any hematoma or any tumor or anything, go for CT MRI. But the best initial investigation of choice is EEG. This will actually confirm the diagnosis, and it can also confirm the type of seizure, just in case it is a seizure. Of course, there are false negative or false positive cases also, so we have to go for further investigations. And before, it is advised that before the patient is withdrawn from the anti-epileptic drugs, the repeat EEG should be done, and the patient should be asymptomatic for more than 3 years, because otherwise it can recur. Now let's talk about the homeopathic aspect of it. Again, homeopathy, as the principle goes by, depends on the individual totality of the case, analyzing the case with its presentation entirely. The list of remedies that we must think of are agaricus, cicuta, Artemisia vulgaris, Bufurana, Kilcaria carb, causticum, cuprum met, Helleborus, Stramonium, Veratrum viridi. Of course, there are other remedies depending on what cases are coming. I hope this information is good enough, and please subscribe the channel for more such videos. Thank you.